most of us just slog through the day pushing through, and we really don't know what our blood pressure is or what it's doing unless we feel this potentially heaviness in the chest and our heart races. Sometimes we ignore those, and then we don't know where to go to get what the blood pressure reading is. So that's really what the whole point of our initiative in K-State Research Extension is about, having agents equipped and available and willing to coach people around what their high blood pressure is, to measure it regularly, to manage it, and to do those activities for at least 4 months.
If you can't remember the last time you had your blood pressure checked, it's time to check it. Left unchecked, high blood pressure, also known as hypertension, can lead to heart attack, stroke, diabetes, or other disease. On today's Sound Living, Extension's role in helping Kansans check and manage their blood pressure. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman. The Kansas Health Foundation's Distinguished Professor of Community Health at Kansas State, Elaine Johannes, says Extension agents are now being trained as Healthy Heart Ambassadors to administer blood pressure checks, explain what the numbers mean, and provide coaching to manage high blood pressure. Elaine, a pilot project has really turned into a signature program, and it's all built around hypertension awareness. And it's something that we think about, I guess, especially this time of year because we're in February, we're thinking about the heart. And this is what's known as the silent killer, and really for a good reason. There are no symptoms.
Oh, yes, Jeff, yes. So February, yes, American Heart Association every year designates February as Heart Month for our health and to get our blood pressure checked and to get it managed. So it was in 2022 that K-State Research Extension became the very first extension system in the United States to become a self-measured blood pressure champion. And that designation is from the federal government's Health and Human Services Office of Women's Health. And that office received our application and said that this is a good group of people in a state that has high blood pressure. Our rates right now, about 33% of Kansans report being diagnosed with hypertension. Our blood pressures are too high. Nationally, we're to be at 27%. And so Kansas has a way to go to reduce our high blood pressure across the state. And Jeff, when I say that, that's really among adults. We really don't know how our younger people are doing. Typically, young people, high schoolers, may not go into their local grocery store or the pharmacy and take their own BP, their blood pressure, with the device. So when we think about Kansas high blood pressure being higher than the national average, those are adults that have been willing to reveal to researchers that they've been diagnosed. And it's of concern. You know, as our population ages, typically we have some of those chronic diseases or conditions, and hypertension is one of those. And it's a costly condition, meaning it can result in heart attack, stroke. There are connections to diabetes, some of the other diseases that we struggle with. And you use the phrase, the silent killer. You know, most of us just slog through the day pushing through, and we really don't know what our blood pressure is or what it's doing unless we feel this potentially heaviness in the chest and our heart races. Sometimes we ignore those, and then we don't know where to go to get what the blood pressure reading is. So that's really what the whole point of our initiative in K-State Research Extension is about, having agents equipped and available and willing to coach people around what their high blood pressure is, to measure it regularly, to manage it, and to do those activities for at least 4 months. So it's a 4-month initiative. It can be started right now. February is Heart Month. But it can also be implemented any time in the year. So we're working with our faculty in the field to get this done.
I would imagine a lot of us only do the blood pressure reading once a year when we have an annual physical. It's something that we should be doing much more regularly.
Mm-hmm. Oh, yes. I don't know if you remember the last time you went into a clinic or a doctor and somebody there takes the blood pressure reading, and it's done really kind of quickly, and maybe it's not reported back so we can understand. So the American Heart Association actually teaches people like you and I and agents how to take a blood pressure that's a valid blood pressure that's done the way that it's meant to be done. And so we teach our agents the Healthy Heart Ambassador approach. And Healthy Heart Ambassador is an actual strategy that teaches an agent how to have somebody come into an office, relax for just enough time for that blood pressure to settle down a bit, because usually we're scurrying around. And then to actually have the person put their feet on the floor, making sure that there's no impediment to how the blood is moving through the legs and the feet. And then the person takes their own blood pressure twice during this coaching event. And then they talk about not what the numbers are, but what do the numbers mean? And the whole process that we teach agents to implement in their offices or with a collaborator, let's say at the public health department, or we've even had this done in a business. The whole process takes time to talk about what do the numbers mean? How does it get managed? And so it's a coaching experience that I know I don't have a lot of coaching when I go to get my annuals because there's so much to be done during that short period of time you have that clinician helping. And I'm not trained in this. Jeff, you need to know. I'm not a clinician, but I am trained to do a high blood pressure reading. And it's a process that we just don't know much about.
And as long as the numbers are good, they don't discuss it. So you really don't get that understanding of what this number means and what that number means and where you need to be on the scale, because there are categories of normal or elevated. Those we can manage pretty well on our own. Some of the others may require more.
Absolutely. Maybe I've shared in a previous talk you and I've had, but I'm married to somebody that lives with a hypertension number that the American Heart Association would say is in the yellow zone. Colors would be great if we knew that we lived in the green zone. Green means go and good, right? So if we know that our blood pressure rate is fairly in that green zone, the diastolic and systolic, meaning the heart at work, pumping, and then the heart at rest, kind of pumping and kind of relaxing a bit. So back to my dear spouse. He lives in what's called the yellow zone, right? And it's managed. And he's been like this for as long as I can remember, nearly 50 years. And that would be considered managed. But what happened is that he knew about it earlier on. It became something that he knew he was diagnosed with and something that he knows that his physician and clinicians help him with. It's managed. That's what the whole initiative is about with Extension. HAP, that's what we're calling it, Hypertension Awareness Prevention Program, HAPP. And HAP is a strategy that integrates the American Heart Association information, strategies, also with the Healthy Heart Ambassador. That's that coaching that I described, which is that individual person with the agent learning how to measure their own blood pressure, and then also now integrating nutrition education, stress management, also access to activity. We're going to be starting Walk Kansas here pretty soon. What a perfect companion. And so it's really the perfect package, I think, to look at hypertension in the state. How do we diagnose? Well, I shouldn't say we, the clinicians diagnose, and then work with our agents to coach around it so it's manageable.
There are some things we can do. I know sodium is something that we're always keeping a close eye on for this.
Sodium, boy, Jeff, I've learned so much about how the pump and hose system of our cardiovascular system works. But if we've got a lot of sodium in our diet or we tend to retain it, then that means there's more fluid, and that makes the heart and all of our veins and capillaries work harder because it pumps more of that fluid. Now, we've also had some of our clientele ask about, okay, does that mean I should not drink as much fluid? Well, no, that kind of washes out these pumps. So we've got to keep the pumps all going. We've got to be able to go to the bathroom on a regular schedule, not retain fluid. And by the way, we also need to know that the blood pressure device that we use is legitimate. The American Heart Association with CDC is an amazing team. They actually go out regularly and they do analysis on blood pressure kits that really aren't accurate. That is a concern. Yes, it's great that pharmacies, grocery stores, others have these apparati that are close and people can get access. It creates awareness, but that does not necessarily mean it's accurate. So our agents are also taught on what's an accurate device. What do people need if their arm is such that they can't get the blood pressure cuff around it? Maybe there's a joint concern. Then there are these wrist devices. So we're learning a lot about what does measurement mean. And measurement, knowing what the number is, then results in behavior change. And I think what I'm most excited by HAP is based on what the community is around now. Yes, there's individual coaching, individuals understanding measurement. They attend group activities and discussions about nutrition and diet and reducing stress. But more importantly, it creates awareness in that community. And that community then can think about, okay, where do people go to be physically active? How do we make sure that there's food available that's healthy and accessible and affordable, especially if you're in a rural community that does not have a grocery store open often? So it's a whole community, whole person initiative around what seems to be a very small element, which is just knowing what my BP is.
Just kind of in closing, I want to ask you about the pilot projects. What was some of the feedback that you got from people who took part in these projects?
Oh, my goodness. People are on prescription, and I'm just giving you what we heard from several of the extension. People are on prescriptions that don't understand how it works. So if you've been diagnosed with hypertension years ago and you go in to see your clinician, your physician annually, and the prescription is just renewed, do we know how that works? Do we know how our diet affects it? So there were those occasions where during the coaching experience, the agent was concerned because the person's blood pressure reading was in maybe the little orange or red zone. And so working together, they found the person an opening at their clinic, the doctor getting checked, then finding out the prescription needed to be adjusted. We had that in rural areas and we had it in urban. We also have had new clinics or community clinics set up. For example, in Wichita, one of our great agents down there found a collaborator in a part of Wichita that did not really have a lot of health access. And so working with the public health department, they had public health people with the extension, with others come in and actually do face-to-face interactions. Yes, nutrition education, but during those educational events, then doing your blood pressure checks. That was in a community that had different immigrant community members, people who did not know where to go for health care. Up in Kansas City, we have new collaborators. Just because Extension said, can we help? Can we pitch in? Out in very other rural areas, we found some gaps identified. I was not aware until we started this initiative that we were having some drugstores, pharmacies close. And in very frontier areas, if you don't get access to that, then that can affect your prescriptions. It can affect how you're managing this condition. So as we were doing the pilot, we were discovering how do we interact with people who don't have access to care, and how do we encourage those connections? And partnerships that we started in the pilot are continuing now. One of those is our State Department of Health and Environment. They have a community and clinic linkage initiative, and thanks to their partnership, we are now getting some CDC funding to not only continue HAP, but then expand it. So we're really glad that we've been able to create a partnership with our state agency.
That's Elaine Johannes, the Kansas Health Foundation's Distinguished Professor of Community Health at Kansas State University. To learn more about blood pressure checks and hypertension awareness and prevention, contact your local extension office. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman, and this is the K-State Radio Network.